running, and in over half those cases that the GPs have said they don't want to be running consortiums. So we have an issue here. Remember, we have private companies seeing an opportunity and organising in advance. The reference to EU law has been stressed by Polly Toynbee in the Guardian recently. And her point is that any willing provider will, of course, include private hospitals. The commissioning consortia will, the bill suggests, have to reach an agreement about good quality care in their local area. What Toynbee is suggesting is that because of the way the bill is currently phrased, and because of EU competition law, the commissioning consortium will not be able to stop private companies using EU law to insist that they get local contracts because they are the lowest bidder. So the notion that it requires some consensus could come up against European competition law, and restrictions on quality could count for little if we're actually talking about, this is what the bill looks like, price competition. Labour is in favour of competition but tended to tie to quality. It looks like that link will be diminished. It's always difficult to see how these changes impact on patient choice. Choice has become almost entirely rhetorical, and it is when we're talking about commodifying services and so on. When I was a kid in the 50s, I could see my GP on any day I wanted to, and he could refer me to any specialist in the country. Seems like a reasonable degree of choice. Now, in the name of extending my choice, it looks like it's a much more circumscribed sphere in which I can make my choices as a patient. The idea that we will somehow make efficiency savings out of this is frankly ludicrous in relation to the evidence that exists about providing healthcare and through comparative work on healthcare systems. Now, if we move on from a critique to a kind of analysis, which is, if you like, a contextualization of what is happening, what I would want to suggest is that, although of course there have been gains as well as losses as a result of reforms to the National Health Service since 1948, the general thrust has been regressive rather than progressive. And I think we have to do something, or accept something that we frequently don't, because it's kind of counterintuitive for us. And that is to make a distinction between a rational case for change, which is what we somehow expect from governments and from bills, that they somehow constitute a case for improving our state of affairs, and the notion that these pronouncements and these bills serve quite other functions, that they are rationalised, I call them legitimation devices. If a government has its own agenda for making these changes, it has to sell it to the electorate. So what we have, I think, in many government announcements are both what purports to be a rational case, but what can also be analysed, and sometimes there's a contradiction here, as a rationalisation of what they want to do for quite other reasons, so we accept that it looks like an improved, more compassionate or whatever service that's on offer. Ben Goldacre likes exposing poor science. Talking about Lansley here. His wrongness is not a matter of opinion, it is a fact. And his pretense that data-driven neutrality is not just irritating, it's also hard to admire. There's no need to hide behind a cloak of scientific authority, murmuring the word evidence into microphones. If your reforms are a matter of ideology, legacy, whim and faith, then like so many of your predecessors, you should simply say so and leave evidence to people who mean it. I think that's reasonable, because the evidence that we have on comparing healthcare systems, on how to deliver good, cost-effective healthcare, suggests that the last route you go is towards introducing markets into healthcare. You do not want to commodify healthcare. if you have a genuine interest in cost-effective delivery of a universal system that's free at the point of need. Here's a bit of sociology. And so it's almost rude to talk about these things when we're discussing policies, if somehow we shouldn't. But I think there are factors that drive what governments do, although governments will also always offer defences that give irrational cases for what they're going to do. We still live, there's overwhelming evidence, in a class society in Britain and in the States and in Western Europe and so on. What has changed, I think, is we don't see ourselves in class terms, as used to be the case a generation ago. So if you have a group of students, they will not think in terms of their class. There are other multiple ways of thinking about who they are and how they belong in the society. But there's no contradiction of saying, while that is the case, objectively, I think there's a good case that class is more important than it was a generation ago. An increasingly global class interest, private healthcare companies are global companies, are more able to dictate to national governments the direction in which they should move than has been the case for a long time. The historian David Lamb said, men of wealth buy men of power. And he's saying that generally, looking back in history. My suggestion would be they get a little more for their money now than they did even a generation ago. In other words, governments, be they Labour or be they Conservative, or God forbid coalition, can't afford to ignore very powerful, increasingly transnational business interests. And this is, I think, why we see in under the aegis of a neoliberal ideology, a change to healthcare, which is taking place almost throughout the world. So even Scandinavian systems are moving a little bit towards the neoliberal end of the spectrum. We've moved fast, but then we were closer to that end in general terms. Anyway, so what is Lansley's patchwork privatisation that's been called? What does it amount to? I think there's no rational case that can be constructed for these reforms. It's a classic case. People talk about evidence-based policy. It's a classic case of policy-based evidence. You decide your policy and then you look for ways to support it that justify it. Opposition to it, therefore, has to be rational, but should be seen as political too. You don't simply persuade a government that is set on a course for reasons that I've intimated, that it's going wrong, that it won't quite deliver as it says it will. It's a political act of resistance to a government that is not responsive to the rational case. Now, if we're talking about resistance, let's contextualise that for a moment. We're in an era, most theorists and researchers suggest, of a movement of movements rather than discrete movements that we were used to. So people have suggested, for example, that the anti-capitalist movement is a movement of movements. And I think one context is that if we act collectively, we're talking about alliances. We're talking about overlaps between different campaigns and what people have in common. It may well be that people who oppose hikes in student fees, particularly oppose EMA being abolished, will be sympathetic to arguments and action against the NHS reforms. They don't all have to be anti-capitalist to be part of that movement of movements. So we're in an era of, if you like, coalition activity in more ways than one. And the technologies that go with those kinds of activity give us a different kinds of connectedness. And many of you here will be more familiar than I am with the technologies. But using the net and other facilities both to organise resistance and demonstrations and protest and to avoid police kettling, to take photographs of what is happening on demonstrations and so on, is a relatively new technology which is very much part of protest. If pursuit of reform happily marries across different campaigns and different needs. That is, that affords a degree of solidarity and a degree of, makes the kind of advances that some people would like more, more on the cards. I think what's also required is a sense of the change in the society in which we are living. I think if we are going to resist through campaigns or other means what we see as thoroughly unworthy and malicious sets of reforms that are being offered to us, then we must understand why these reforms are being advanced and look very seriously at how it might be possible effectively to resist them. And I know Wendy will be talking about some of the ways in which resistance can be offered. So it requires an analysis, if you like, about changing society and a calculation about what can be accomplished in relation to one campaign alongside another. And utopian realism versus utopianism, it's an important point in the sense that I think it is quite reasonable to have a notion of how we stand now, and if we don't like the reforms that are being offered, what would we like in their place? In other words, what would a good healthcare system like? And what kind of society is necessary to accomplish that? To think along those lines seems commonsensical, but is very different from what theorists have often called utopianism, which is the notion that one produces a kind of blueprint for the ideal society and sets off in that direction, which very easily converges into a kind of totalitarianism. We've seen that often enough in the past. So analysing society you live with and thinking seriously about how to make a difference to it is not the same thing as taking on board some blueprint and argument for it. Now, the context in which this has been mentioned, we're thinking about resisting reforms, is this one. The procedure, much the same in the Commons as the Lords, is that the bill will go, it's gone through its first and second reading, is now in the committee stage, and goes to report and third reading stages, then transfers across to the Lords. We don't have, I think, have a detailed timetable for this yet. Then after that process, there's consideration of amendments and royal assent. So there will be a number of, as it were, critical junctures around protesting the reforms. And this is a matter collectively as to how people think that can be most effectively managed. Now, I've had my sort of half hour or so I'm going to stop and hand over to Wendy, and then I hope we'll have a good internal debate about where we go from here.